Well, thank you, and thank you for the invitation here today. I'm going to be very brief, probably won't take up my time, and I'm going to be blunt. And I have a very simple, straightforward message, and that is that reconciliation is good for our health, not just for Indigenous peoples, but for all Canadians. The reason that reconciliation is good for our health is because inequality and injustice are bad for our health, and this audience knows that well. Preaching to the converted, which is always the problem with every conference, of course. Now, I'm going to warn you ahead of time that I'm a data geek. You know that if you read my column, so I'm going to cite a lot of numbers. You know, the most single powerful symbol of inequality in Canada is this yawning gap between the health of Indigenous people and non-Indigenous people. The health disparities are legion. Again, we know these, but they bear repeating. An infant mortality rate for First Nations and Inuit children that is 2 to 4 times higher than the rate for non-Indigenous people. Life expectancy that's up to a decade less in some Indigenous communities. The rate of traumatic injuries is 4 times the rate of the general population. Per capita, First Nations and Inuit people suffer more motor vehicle crashes, drownings, death by fire, homicide, accidental poisonings, and firearms-related injuries. They suffer far more disability, on average 12 years of disability for a person, an Indigenous person, and in very difficult conditions, often in remote communities. Suicide rates are 6 to 11 times higher, and we know that those are probably underestimated. There was an interesting story yesterday saying that most Indigenous suicides in Northern Ontario are not recorded. They're called something else. The rate of diabetes is 3 to 4 times higher than the general population. Tuberculosis rates among the Inuit are 270 times higher than Canadian-born non-Indigenous people. Just last week, another teenager, an Inuk teenager, died of tuberculosis in Canada. In 2018, that should be unthinkable. HIV/AIDS rates are growing fastest in the Indigenous population, the only population where it's growing quickly in Canada. Medieval waterborne illnesses like dysentery and shigellosis are still commonplace in many First Nations communities. And I could go on and on for probably another half hour. There's no genetic predisposition or any medical explanation for any of these outcomes. They're not medical issues. They're fruits of inequality, of racism and colonialism, to call them by their names. In this audience, again, you know well what the key determinants of health are. Individually and collectively, it's social and economic factors like housing, income, education, environment, empowerment, a sense of belonging. Those are the things that make us healthy, not sickness care. Now, the data from First Nation, Métis, and Inuit communities in these areas are even more dismal than the health numbers I just gave you. The unemployment and poverty rates are 3 times those among non-Indigenous populations. And I won't talk about the quality of the work. Only 9% of Indigenous people have a university education. That's less than half the rate in mainstream society. There are accessibility problems of all sorts, all kinds of cultural and practical barriers to higher education. More than 1/3 of First Nations and Inuit people have in government jargon, a core housing need, which means, in basic English, that their houses don't meet the most basic standard of acceptability. They're overcrowded, lack of running water, inadequate sewage. People still use honeypots in the 21st century. They put their fecal waste in plastic bags, and it's picked up once a week by a truck. We give it that delightful name, honeypot. Again, just this week, a child on an Alberta First Nation died of a simple respiratory illness because that child was living in a house, grossly overcrowded, rundown house with 10, 12 other children. They all got very gravely ill. This is spitting distance from Calgary. The environmental contaminants that stalk some communities are frightening. Mercury, PCBs, pesticide levels are all much higher in the bodies of Indigenous peoples than other Canadians. There are 478,000 Indigenous children in Canada. 38% of them live in poverty. The rate is double that on reserves, 60%. Now, we could go on all day with this horrific data. And I have to say I'm a bit uncomfortable doing so. And I'm going to elaborate on why in a moment. But there are definite limitations to that. And I hesitate, when I was preparing this talk, I hesitated putting any numbers in it, this kind of statistical porn we have to be careful with. And we use it a lot in the media. But I hope it has a purpose in this setting. But what the numbers do is they remind us that we've created this perfect storm of conditions to destroy health and the soul of these populations. You couldn't imagine, if you were an evil tyrant, as in the movies, you couldn't dream up a better way of making a population unhealthy and dying quickly than what we've done in Canada. Inequality has bred ill health, and ill health has bred more inequality in a vicious circle. Now, what's important to underline in every one of these statistics I've cited is that they're a direct result of public policy failures and public policy choices. They're not accidents. As I said, they're not a result of genetics or medicine. They're choices that we've made as a society, deliberately or thoughtlessly at best. Our approaches range from benign neglect to deliberately genocidal policies. Now, some people bristle when I use the word genocide. It's a big word. Perhaps not in this audience. You're probably not horrified by that. But certainly among Globe and Mail readers, that makes them uncomfortable. We don't like to be challenged in our comfort, the 1%. Well, 5% maybe. So I think it's important to back that kind of language up. And I have to do it to my editors, so I'll tell you what I tell them. Again, being a data geek, I turn to the numbers. And I remind them that in 1491, prior to first contact with Europeans, there were tens of millions of Indigenous peoples living in the Americas, including about 2 million in this territory we now call Canada. 4 centuries later, the Indigenous population had plummeted to about 100,000. It almost disappeared. There's only one way to describe a 95% drop in population, and that's genocide. That's how you back up that number. Now, you could argue that the transmission of diseases like smallpox and measles, which accounted for a lot of deaths, you can argue that that was accidental. But the hunting of indigenous people, the delivery, pushing them off the land, the wars, that was deliberate. And there were more overt policies closer to today in so-called civilized times. And you heard many of these in the great talk last night by Tanya Talaga. So I don't want to repeat all that, but I want to recap quickly. So in 1876, the Indian Act was enacted, still exists. Legislation that was, quote, the final solution to the Indian problem, unquote. It was the basis for the apartheid system in South Africa. Residential schools were created to assimilate and to, again, quote, kill the Indian in the child, end quote. More than 150,000 children went through that system. Few of them came out unscarred. Tens of thousands more Indigenous children were taken in the 60s scoop. And the apprehensions continue to this day in our child welfare system. There are more First Nations children in foster care today than there were children in residential schools at the peak of their existence. You have to digest that. That's a real tragic number. Today, there are roughly 1.5 million Indigenous people in Canada. Remember, I told you there were 2 million in 1491. There's still fewer than pre-contact. The common denominator in these reductions in population are genocidal policies. These policies were designed to strip away control and to marginalize, to sicken, and to kill. They were done, many of them deliberately. We know that lack of control over important dimensions of living is one of the really key determinants of health. When you strip people of their language and their culture, their identity, their connection to the land, to their history, you destroy them. You destroy their souls and their health. One of the most important enlightening studies that I've ever read on Indigenous health was a rather obscure paper written by a pair of academics from the University of Victoria, Michael Chandler and Christopher Lalonde. In their 1998 paper entitled Cultural Continuity as a Hedge Against Suicide in Canada, Canada's First Nations, they examined suicide rates in all BC First Nations and got unparalleled access to this data, which we don't have enough of. They found there were communities with really high rates, and they found communities with no suicides, no record of ever having any. Now, there's one thing that distinguished these two groups, these two very disparate groups. The communities that were healthy, i.e. those that had low or non-existent suicide rates, had self-government. They had people who spoke their language. They had people who embraced their culture. They were independent and proud and healthy. Now, there are a couple of other underlying messages in that study as well. One of them is that it's a reminder that all those statistics that I gave you reluctantly a little earlier, they're misleading. They're actuarial fictions. They tell us only a partial story. Now, a useful story for public policy purposes, for journalistic purposes, for making a point, but they don't tell us the more subtle, important story. And that is that there are 600, 700 culturally distinct Indigenous communities in Canada. They're all very different. National statistics hide the fact that there are many successes, communities that have resisted public policy horrors in their own ways. There's a lot of resilience out there, a lot of wisdom that can be tapped into, that can be learned from, that can be scaled up in other communities. I think one of the most important things we can do as a society is to enable this cross-cultural exchange between Indigenous groups to learn from each other. And there's a lot of that going on that we don't talk about. The other essential message hidden in that research is that the key to healthy communities is self-determination. That's the really overarching message that we should take from a lot of health research and from a lot of that data. Now, I'm not going to tell you what's required for reconciliation. That's not my role, not my place, and it's also really well known. You heard this very well from Marcia Anderson several times this morning. We have all the reports. They've been done over and over again. We have the recommendations. If there's one thing that Canada does better than any other country in the world, it's produce reports. And nowhere is that more true than in healthcare. We have raised vast forests to produce reports and produce recommendations, wonderful, brilliant recommendations that are very rarely acted on. Or even worse, they're implemented, they're cherry-picked. We half implement them. That's sometimes worse than not doing anything at all. And again, I'm stealing that from a speaker earlier this morning. But in my business, we call that research, not stealing. Now, what we have to do with all these reports is move from the navel-gazing, move from always feeling sorry. Oh, we're so sorry. In Canada, we're sorry about lots of things. But we have to take action. That's the way you really demonstrate you're sorry. At least that's what I tell my children. Now, there are great detailed proposals out there for moving ahead, for fixing things. One of my favorite is a relatively new one. The Spirit Bear Plan that's championed by Cindy Blackstock. If you don't know about it, I'd encourage you to read it. Essentially, a sort of a Marshall Plan for massively reinvesting in Indigenous communities. If you know your history, you'll know that after World War II, the Marshall Plan was implemented to rebuild Japan. The Allies had destroyed that country, and they felt that, if you leave people in poverty and hopelessness, all that's going to happen is there's going to be another war. So they rebuilt their economy. Now it's one of the richest, wealthiest, fairest places in the world, thanks to that intervention. That's the scale and the scope of the fixes that we need in Canada. And we have a lot more mess to clean up than after the World War, Second World War. We have 400 years of mess to clean up. And again, I'll remind you that all these problems were created with public policies. And we can fix them with public policies. If you can do damage, you can do good. Those are flip sides of the coin. They're choices. Now, all those horrible health outcomes that I spoke of earlier are due to one thing. They're due to structural problems. we can create better structures. We have the ability, we have the talent, we have the money. There's no excuses. Now, we can do it for any number of reasons. We can do this because we believe in social justice, because we believe in human rights. That's the right reason to do it. But we can also do it because we believe it's going to be a good return on investment, that it's good for the economy. And it is. You can make this argument across the political spectrum. One of the worst things about inequality is that it's bad for rich people because it makes them less secure. They have to spend more money. They don't have as much of a labor pool, etc. These are all, the way that we treat our Indigenous communities is bad for us in that it's a huge waste of talent and labor, etc., if you want to put it in purely business terms, which again we like to do at the Globe and Mail. We have to stop making excuses. One of the worst excuses is that there's no money. Marcia Anderson this morning threw out a question to me at the back of the room. She said, wasn't there a study showing there's a lot of waste in healthcare? In fact, there are many, many studies that show roughly 30% of all health spending is deemed ineffective or harmful. So 30% of health spending in Canada is $60 billion a year. That's a start. That's a little bit of money. And beside that, Canada is not a big spender in health to begin with, generally, never mind in Indigenous communities. We're middle of the pack. And we spend on average 30% less, 1/3 less on social and health programs for Indigenous people. That's the whole basis of the human rights complaint that was taken up by Cindy Blackstock. Now, worse than healthcare is our spending on social services. Canada is the country that spends the least on social services in the developed world. Only 13% of our GDP goes to social services. That's been falling steadily for 30 years. Take a country like Denmark, it's 27%, double. Again, a country that's much more equal and fair and has a pretty booming economy, by the way. It's not hurting them to spend money on social services, quite the contrary. The healthiest countries in the world have one thing in common. They're the most egalitarian. They're the most fair. They have the most social justice policies. They've recognized that what's really costly in society is marginalization. Condemning people to poverty and ill health costs everyone in society a lot. We can't afford to waste another generation, especially a generation of Indigenous peoples that has the fastest growing birth rate in the country. Now, last week was the anniversary of the death of Martin Luther King. So there's a lot of stuff floating around, a lot of stories that we could read, speeches that we could watch to be inspired. And when I was reading stuff, one of his quotes jumped out at me. It stood out. It was this. He said in 1962, "The price that America must pay for the continued oppression of the Negro is the price of its own destruction." We could easily paraphrase that for Canada in 2018. The price Canada must pay for the continued oppression of its Indigenous people is the price of its own destruction. So thank you for your attention, and I welcome any questions or comments you might have. Thanks. Oh, they're all so shy. Monica told me you were shy. Nothing? Oh, uh-oh.
Thank you for bailing me out with the study. I knew you would know. But just building on that last point that you had, I was reading some work by Angela Davis a couple weeks ago. She's done a lot of work on mass incarceration in the prison industrial complex. And one of the points that she makes is actually mass incarceration, and I think we could say the same thing about mass child apprehension, both very topical issues in Canada. It actually costs a ton of public money. And we make an ongoing choice to fund mass child apprehension and mass incarceration instead of investing in those social programs that would provide a quality of opportunity for good health. So I was just reflecting on that with your quote from Martin Luther King, and just wanting to reflect on that. a bit, like why in our public conscience we're actually willing to spend more money on incarcerating and apprehending Indigenous kids than we would be in providing them with equality of opportunity. And also what you see as the role of the Globe and Mail in starting to shift the social discourses that could then shift political will around those funding and policy decisions.
Okay. Yeah, so you mentioned incarceration in addition to apprehension, and I had some data on prisons that I didn't put in either, but obviously gross overrepresentation of Indigenous people in prisons. But it's a really good social question, and I don't know the answer to it. Why are we willing to waste money on things that we know cost us more as a society? And you know, the best example more broadly is the war on drugs, right? We've spent trillions of dollars prosecuting people because they take drugs because it's pleasant and it's fun. And it makes no sense. Now there's a little bit of a shift on that on harm reduction, but I think that philosophy of harm reduction applies much more broadly to things you mentioned. It makes absolutely no sense to spend all this money to take kids away from their families, send them south, et cetera, et cetera. Beyond the being humane about it, just in economic terms, you can make a really good argument against it. So why do we think that? I think it's if nothing else, it's just a hole in our public policy discourse. There's not very, up the street in Parliament, if you've ever been to question period, it's not very thoughtful debate going on. It's rhetoric being thrown across the floor. So I think we need some kind of forum for more thoughtful debates where it's not always preaching to ourselves, to the converted. So that's the first part. What's the role of the Globe and Mail? I don't know. I think the role of the media in general is to challenge the status quo, to raise these issues. I think the media in general has done a fairly good job on some topics. If you look at Tanya's work on exposing the deaths in Thunder Bay, that's a classic example of how the media can do good. The missing and murdered Indigenous women file took a long time to get to it, but I think has done well once it got started. So I think a lot of it is just hesitation. We're in Canada a very conservative, small C conservative country. We're reluctant to tackle these things that make us uncomfortable. We have a lot of, I do lots of, I know you're at one of my talks, Marcia, recently, where I talked about this history where we have this love of mythology in Canada. We mythologize our Medicare, we mythologize our fairness. We think we're super generous people, and in fact, we're the least generous on social programs in the world, to be honest. So we have a lot of myths about ourselves that we need to challenge. So what's the Globe's role? I think the same as any other media, we should be doing more of this. And I think in fairness, it's infinitely better. I've been there 32 years. I think our coverage of Indigenous peoples is not great, but it's infinitely better than it was a generation ago. And it's changing, but I don't think it's changing fast enough. Sorry for the long answer. But.
My question was kind of along what you just ended on, so I'm hoping people won't let you off that easily. There's got to be someone out here.
Yeah, there's. Yeah.
Oh, is there someone here? Sorry.
Yeah.
Do you want to talk loudly, or do you want the mic? Here, I can bring it over to you.
It's not me that you have to worry about, it's them.
Thank you.
You had mentioned how there is a streak of small C conservatism in Canada when it comes to harm reduction and just the drug epidemic. I was wondering if there would be a role, in your opinion, to play for, instead of focusing, harm reduction is obviously very important, but for that section, cross-section of society, to build a coalition that wants to address this head-on, if there would be some kind of if it would make sense to look into the bodily autonomy side of the argument to appeal to those people, perhaps?
Yeah,
That's
maybe there's I never thought I'd see the day where police were saying, we should have free drugs and needle exchanges. So there's some unexpected alliances that are possible. So I think the economic arguments are really powerful. When I speak to groups about advocacy, I always say you have to speak the language of the people whose minds you want to change. And the language of public policy is money. for better or worse. So you have to make those powerful economic arguments, and I think they really cut across partisan political lines when you get right down to it. If you can get through people's rhetoric, it's surprising how many real conservatives have embraced harm reduction because they see the financial benefit. Now, whether it can be extended, whether we can overcome our, we don't even only have a streak of conservatism, we have a streak of racism, let's be frank. Whether that can be overcome, I don't think that's as easy.
Hi, I'm sorry, I don't know the stats for the demographics and the dementia, whether dementia is a big issue with the Indigenous community, but it is a issue that's facing the rest of Canada, with the baby boomers hitting 70 and they're aging very rapidly. Dementia rate is 2% at 65 and it doubles every 5 years. And if you have multiple health issues like high blood pressure, high cholesterol, diabetes, AFib, etc., it doubles it again. So the baby boomers currently at early 70s are 48% dementia. In 15 years at 85, it's going to be 32 to 64 dementia. The current health system is not going to scale to those kind of numbers, and there needs to be more of drive towards more creative solution, more innovative solution, more options for seniors than long-term care wait lists that can last 2 to 8 years, and private retirement home that can easily cost $5,000 to $7,000 or more. I know people who are paying as much as $9,000 or $10,000 for dementia care. So, do you have any comments on that?
I could talk for an hour on dementia, but I think that the brief answer to your question is yes, as we have to change our social services system for Indigenous people, we have to change it more broadly. Our health system should be more community-based. It should be less institutionally based. The solution is not to take this growing population of people with dementia and shove them into institutions for the rest of their lives. It's to do like other countries that are ahead of us on this. Denmark's a good example. I went there to look at dementia care. A lot of small residential homes, home-like facilities where people are kept safe. Dementia villages are popular. There's several in the Netherlands, one opening in BC. So it's very much these things tied together in that it's about having a different philosophy about healthcare. We have a sickness care system, and we have to move towards more of a healthcare system, whether it's for Indigenous people or the mainstream population.
Thanks, Andre, for the talk. I was just wondering if you could elaborate on the point you mentioned about how the apartheid system in South Africa is modeled based on the Indian residential school. Because I learned that just sort of in conversation with individuals, and I'm someone who spent many years in schools in Canada, and I had no clue about it. So thanks for explaining that.
Sorry, can you repeat the last part? I have bad hearing in one ear. I heard half of what you said. I'm sorry.
Oh, sorry. No, I was just hoping that you might share your knowledge when you refer to South Africa's apartheid system being modeled after the Indian residential school in Canada. Because I have only learned that and heard that very recently, yet it's almost impossible to find any reputable source documenting this, but I've heard that confirmed by a number of individuals I felt I could trust, and so I would appreciate you explaining more of that history for us. Thanks.
Okay, I don't know that history well enough to want to comment on publicly, but I'm sure someone will come up to you in the room. There's many knowledgeable people here, and I'm sure some with more historical background than me will be able to explain it. But I will take what you said as a challenge, and I'll read up on it as well, because I too have heard this many times, and sometimes we hear things and we accept them as truths, and they aren't. But if it wasn't a model, it might as well have been. How about I'll put it that way? Because it's very similar.
Can I jump in this conversation?
Please.
So the residential schools was set up with an apartheid reserve system in which First Nations were legally required to stay on reserve.
Yeah.
Needed an Indian pass to get out. It would be given by a Government of Canada employee. That Indian pass system actually only ended in Manitoba in 1960. In the origins, the late 1920s, 1930s of South Africa, when they're trying to deal with their, quote, race problem, they came here, they came to the US, who were both doing reserve systems. Into Alberta and Saskatchewan, I believe. Cindy Blackstock has researched this, if you want where you find it. And the federal government posed this as a great solution for race-based problems. Keep the Indians away from us. Keep them in places where they can go to die, which is actually the very first reserve set up was Manitoulin Island. Lieutenant Governor Bond Head at the time went out on one of the very first reports, a report every 30 to 40 years, what to do about the, quote, Indian problem. And he went out and decided that, yes, in the 1840s, that Indians were all going to die anyhow. So why don't we put them on a reserve where they can just die quietly, which turned out to be the very first reserve set up even before Canada as a country, and that was Manitoulin Island.
Great. See, I told you there were much smarter people than me in the audience. There you go.
I'd also really like to recommend the movie The Pass System for anyone who's more interested in learning about the pass system on reserve. In terms of, as a member of the media, we're expecting you to be very educated about the use of statistics, about Indigenous affairs. In terms of that responsibility being placed on the media, have you seen any good models for delivering that education in a way that's fair to members of the media, but also helps them develop an understanding of the issues they're asked to talk about? Because I love the fact that we're seeing more Indigenous reporting about Indigenous issues, but there are so many places, for example, in politics, where we need that understanding to unfold and have an understanding with everyone.
Yeah, so are there formal programs? Not too many. It's pretty grim in the media because our media are dying, to be honest, and we don't invest in any training or education. It's getting worse in many ways. People are just thrown in with no background. I'm lucky in that I've just been around a long time. I picked up some stuff, but it's pretty grim in total. Now, there are little bright spots. So I know there are, Duncan McHugh, for example, has a program at UBC where he teaches Indigenous teaches journalism students to write about Indigenous issues. He's involved in a group called, now I should know their name, but I only know their Twitter handle, RIIC, which does education, again, on Indigenous issues for journalists. So there's little programs out there. I was involved in a program called the Mindset Guide, which is about helping journalists write about mental health issues. And with Duncan's help, we did a whole chapter on Indigenous issues, in particular ways to approach people in Indigenous communities. That's been helpful for journalists. So it's kind of a lot of stuff done by hook and by crook, but not a lot of formal training, unfortunately. But again, it's necessary. I think there are some good recommendations in the TRC report about the media. And I think we have to, as the media, work on implementing those as well. I know at the Globe we actually have a committee, being a good bureaucratic organization, on those, and that's a start. So if nothing else, we've changed our language. We're much more careful on the language now, and that's a start. But it's a baby step. Thanks.